This one.
But did you see the full screen again?
Earlier, but now it says phase home. So one of the people, this is what the camera's seeing now.
But are you seeing that?
Yeah, this is the zoom. But instead of seeing
Charlie,
instead of seeing that, we should be seeing this up here. But we're seeing
right, I don't know why, I'm gonna.
the webcams.
But Charlie should be, he is the host.
Yeah.
What is this?
So maybe because like now it's showing. Oh, that's just one of the
Oh, but we want to make sure we see
that.
Kristin talk.
Yeah,
Well,
because it was up there earlier.
yeah, it was.
Can't go to the cameras. Okay. Maybe I can figure out. We're trying to figure out why I'm on the Zoom right now, and it's one of the participants is shown here instead of the webcam, which the webcam is here and it's on. So why is it not showing? Usually it would show the webcam up here. Oh.
Just dealing with a couple issues.
Wait, Charlie, you should have if you're gonna be.
What's that?
You need a microphone. Yeah.
Okay. So before we get started, we had just,
when it is that way.
we'd love to see all of you here tonight.
Totally understand that one. Yeah.
Grateful that you were able to come. And I kind of have been inspired why I like to keep doing another class. I think I've showed you the list of people who sent the cards and the letters. And I just have one testimonial that I received just today that I want to share with you because it's inspiring to me and I hope it's inspiring to you. I think we have a couple new members here. So I just want, this is from one of the class participants, not in this class, but in a Wednesday class. I wanted to let you know I've been absent from your Wednesday classes for a couple weeks because I was diagnosed with benign positional vertigo. After a bit of scare, I went to Riverbend and for a possible stroke. And by the way, I'm doing better. The vertigo's better and it's controlled and I feel safe to drive. But the better news is that since I've been applying what I've learned in your classes, my good cholesterol has increased. The bad cholesterol stayed the same, though I've lost weight. My A1C, hemoglobin A1C, check for diabetes, is down, and I no longer am considered pre-diabetic. My inflammation markers are going down as well. My blood pressure is now within a normal range, and I'm not in so much pain. All my labs are considered within normal ranges now. This is just after 2 months. This is all because I am more mindful of what I am putting into my body as fuel. And it has made a huge difference in my health in just 2 months. Thank you.
A couple announcements before we start. Two is we still have some openings left for the grocery store shopping tour, which is Thursday, September 4th. So the Thursday after Labor Day at the Winco in Springfield. So you can sign up. It's on the newsletter. You can just send an email to swagnon1969@gmail.com. It's also in the newsletter if you have that at the top of the announcements. You'll see that there. So just send me an email if you want to join for that. Karen Booth, one of our dietitians, will be leading that, and I'll be there too. So check that out. And then, if you, does everyone in here already get the newsletter on Sunday mornings? So if you haven't, go to the livelifestylemedicine.com website, and at the top there you'll see subscribe to newsletter, and just put in your name and your email, and you'll get a welcome newsletter right away. And then every Sunday morning you get a newsletter. It always just kind of keeps you up to date with everything that's going on, the class schedule, all the events, and And then also at the end of September, the 27th, which is a Saturday, we have 2 events that day. So our monthly walk, which we just had our walk this past Saturday, and then we'll have another one then. And then later that same day, 6:30 p.m., we'll meet back here, and we'll do a movie night. We usually like to do a movie night every quarter. And it's we're going to show Forks Over Knives, so I'm sure some people maybe haven't seen it, but we'll serve popcorn, and it's just a time to get together and chat and talk about it. So those are some things coming up. Saturday, September 27th is the next walk and the movie night, and then we'll stay tuned. Probably in October sometime we'll do our potluck. We'll just have a potluck at the end, and then Tamara will be having her next cooking class in October as well, and she'll figure out which Tuesdays she's going to do that, and she'll get me her updated flyer, and that'll be on the website and in the newsletter, so you can sign up, see how to sign up for that if you want to do that. So all those things are coming up, and also just always want to thank the church for letting us have these classes here for free, and I always want to thank them. Yeah. And then, as always, too, any time you're making any of these changes, dietary lifestyle changes, be sure to be in communication with your medical provider, because as we talk about, your blood pressure could drop too low if you're on blood pressure medications. Your blood sugars could drop too low if you're on insulin and other medications that lower blood sugar. So it's lifestyle serious medicine. And so without further ado, I'll let Dr. Linzmeyer and Kristin take over. All right.
Hi, everyone. Thanks for coming. I just want to introduce myself a little bit. I'm Kristin Linzmeyer. I'm a board-certified cardiologist for adults and also board-certified in lifestyle medicine. And I have a practice at Oregon Cardiology at Riverbend. So hopefully I will never have to see most of you there or in the hospital. But if you ever do need to come and see a cardiologist, I did leave my cards out in front where the books and things like that and flyers are, if you want to take one just for future reference. So I decided to kind of switch gears with my career a number of years ago when I was feeling pretty frustrated with how we were practicing cardiology. And you have to understand, in a subspecialty like cardiology, we tend to see only people who already have heart disease or cardiovascular disease. I mean, that's what we're there for. But I did see a lot of people who would ask me what to do to lower their cholesterol and blood pressure and things like that. And I just felt very frustrated and kind of impotent as to what I could really do to help people without prescribing a handful of medications. And I am not anti-medication. They're wonderful things when you need them and in the right setting. But there are other ways. And these are ways, like through lifestyle changes, habits, and practices that were not really taught in medical school. And so I kind of had to be self-taught in a way like, Charlie and Scott and Eric and a lot of the other heads and leaders of this group. You kind of had to go out and find this information yourself. There's maybe more of a direction in medical school curricula and residencies to teach more nutrition and more lifestyle. And I'm sure you may have heard there are actually lifestyle medicine residencies that now fresh graduates out of medical school can go and participate in, which is wonderful. And so when I ever need that kind of doctor down the road, hopefully they'll have a little more training than I did, formal training than I did. So go ahead. So cardiovascular disease, you may have heard, is the #1 cause of death in our country. And it involves the whole vascular system. And this is really, really important because it, a lot of people think that our organ systems are in silos. I'm taking these medications for my heart, and I'm doing this to help my kidneys, and I'm doing this to help my brain. But the thing is that the cardiovascular system and the pulmonary system and the kidney system, they're all connected. It's like they're all holding hands. So if one starts to fail or struggle, the other ones are going to start to fail or struggle. So what we mean by cardiovascular disease involves things like stroke, which is vascular disease of the brain, heart attacks, of course, which is vascular disease of the coronary arteries, erectile dysfunction. That is almost always, not always, but almost always a vascular disease. There are certain other hormonal imbalances and endocrine dysfunction and some medications that can cause erectile dysfunction, but we consider that the canary in the coal mine because for many men, that tends to manifest before they tend to get other symptoms of cardiovascular disease. Peripheral vascular disease is the vascular disease that's in the legs or the other arteries going to your limbs, and it can cause a lot of pain and suffering. And then, of course, cardiovascular disease involves other diagnoses like heart failure and like abnormal heart rhythms, which are arrhythmias, like atrial fibrillation. And the pathways that lead to cardiovascular disease, so cholesterol and inflammation and obesity, those sorts of things, all that oxidative stress, they can lead to cardiovascular disease, but they're very similar processes that lead to other diseases like cancer, like diabetes, like dementia. And so we have a saying in lifestyle medicine that's what's good for your heart is good for your head. So, like I said, no organ system is in a silo. It's never functioning independently of the other organs. So if you're doing something to help your heart, you're exercising, you're eating differently, you've stopped smoking, things like that, that's also going to help your brain. It is also going to help your lungs. It is also going to help decrease your risk for diabetes. So you could extrapolate that saying what's good for your heart is good for your head, is good for your kidneys, is good for your GI system, etc. Next slide. So I mentioned that cardiovascular disease is the number 1 cause of death in our country. When you look at premature deaths, which are, if we never had any disease and we were all going to die eventually of just falling asleep when we're 105 years old and that's it, and that's how we're all going to die. Premature death, of course, is dying sooner than you really should of like a heart attack or a stroke or something like that. Out of all factors that contribute to premature death, diet is the number 1. Our nutrition, what we put in our bodies, is the number 1 contributing cause of premature death. And so this, if you look on the right, that's the Heart Attack Grill. Have any of you heard of the Heart Attack Grill? It's in Vegas, and I think they may have other restaurants. It's like a chain, but the big one's in Vegas. And if you weigh, when you walk in the door, they weigh you. And if you weigh over 135, over 350 pounds, you get to eat for free. The wait staffs, the waiters, are all dressed as nurses. And they, you see the hamburger, the massive hamburger on the left side. So each burger is equivalent to 1 bypass. So you know what a bypass surgery is, a coronary artery bypass grafting. That's when you have so much disease in your heart arteries that you have to have open heart surgery, and they take veins and arteries from other places in your body and they bypass the blockage, kind of like a detour, to give your heart fresh blood supply. So they call their burgers the bypass burgers, and if you only get a burger with 1 patty on it, that's a single bypass. If you get a burger with 4 patties on it, that's a quadruple bypass. So basically, this restaurant is just telling you, by eating our food, this is kind of, you are what you eat, or you're going to become what you eat. And they fry like their fries and their burgers in lard. And so, this is maybe an extreme example, but the standard American diet, which many people eat or feel like that's their only option, tends to be these kind of heavily based on these kind of foods. Next slide. So how does our diet harm? What? Oh, okay. How does our diet harm us? When it specifically, since I'm a cardiologist, we're going to talk mostly how it pertains to cardiovascular disease, but remember, nothing's in a silo. Trans fats and saturated fats are the biggest kind of factors that harm us when with our diet. And saturated fat is a direct inflammatory factor. We get a lot of saturated fat from animal-based products. You can also get it from plants, but it's much more heavily in animal-based products. Animal-based products, like meat, also contains small amounts of trans fats, but trans fats tend to come more from processed foods like baked goods, things like that. And if you're looking at like a nutrition label, you can tell something is a trans fat because it's made in a laboratory. And the trans fats usually are described in the ingredient list as partially hydrogenated oils. Okay, they're very inflammatory also. So I have heard, I think Scott and Charlie and who knows who else use this example, and it's a pretty good example. If you sprain your ankle and it's swollen and it's inflamed, and you keep walking on it, or you keep twisting it, and you keep spraining it, it's never going to heal. It's going to be chronically swollen and inflamed and painful, and it's not going to serve you very well. You're not going to be able to walk very well, or run, or jog, or do whatever the things that you want to do. So eating is very similar. When you're eating these very inflammatory foods, it's kind of like hitting your knee with a baseball bat or spraining your ankle over and over again. So you eat, and those inflammatory effects hit your body within the first 4 hours after that meal. So what do we do about 4 hours after our last meal? Well, it's usually time for our next meal. And then you eat a hamburger, or you eat hot dogs, or you eat chips, or you eat a lot of processed foods, things like that, a cheese pizza. And you're doing the same thing to your vascular system again. And then 4 hours or maybe 6 hours later, as the worst of those inflammatory effects have taken place and starting to die down, well, then you eat again. And so that is why our vascular system never, when we're eating the standard American diet, our vascular system never really gets a break. We never let it heal when we're consistently eating the standard American diet. And then dietary cholesterol, and I put that down toward the bottom because dietary cholesterol is very important, of course. And who in here knows in what food groups does dietary cholesterol come from? Any ideas? No? Dairy? Yep. Eggs? Yep. Cholesterol comes in eggs. Yep. Meat? Yep. Cholesterol is only found in animal-based products. It is not found in plants. So not everybody absorbs dietary cholesterol the same. There are some people who could eat a diet that's very high in cholesterol, and it doesn't necessarily affect their blood cholesterol levels, but other people are very sensitive to it. And so dietary cholesterol is one of the building blocks of cardiovascular disease, and so that's like an easy kind of target right there if you want to minimize adding cholesterol to what your body's already making on its own. Eliminating the sources of cholesterol is the first step. Okay, next slide. So our body has some defense mechanisms, which is really, really handy when it gets insulted like this, when it sees all this inflammation and oxidative stress coming their way, or coming its way. Nitric oxide is one of the best chemicals that our body makes, and it's very, very healing for our arteries. It dilates our arteries. So when you're exercising, you want your arteries dilated in your heart because your heart's working extra hard. It needs that extra oxygen and blood supply and all those extra nutrients. It decreases the stickiness of certain blood cells like platelets, so they're less likely to clot. It decreases the inflammation in the lining of the arteries. It decreases atherosclerosis, or that plaque sludge formation. And it decreases some of the kind of scar tissue that can help close down the arteries as well. The other component that helps the lining of your heart arteries is the endothelial progenitor cells. Now, your endothelium, and there's not going to be a test after this, so you don't have to memorize any of this, but your endothelium is that very delicate, kind of fragile inner lining of your heart arteries. And it's like the barrier that is helping keep the blood going where it needs to go and in the right direction and being able to dilate when it's appropriate and constrict when it's appropriate. Well, these endothelial progenitor cells heal the lining of the blood vessels. Your HDL is your good cholesterol. That helps remove the bad cholesterol from the plaque and bring it back to the liver to get processed. And then short chain fatty acids, we're going to talk a little bit more about that in a number of slides later, comes from fiber, which you're going to get only in your diet. And who knows where fiber comes from? Plants. Fiber is only found in plant-based foods. It is not found at all in any animal-based products. So short-chain fatty acids are incredible healing molecules that have been shown to decrease the risk of multiple disease pathways, like for cancer, for dementia, for heart disease, for diabetes. And you're only going to get those developed or formed in your body for your body to use if you have a really healthy gut microbiome plus fiber. And you get the healthy gut microbiome from eating fiber. Okay? Yes? Oh, are you able to see though if I stand over here? Are you okay? All right, you're all right. Okay. Go ahead. Next slide. So I kind of already addressed this. So what causes coronary disease? So we're now talking specifically about the disease of coronary artery disease, which is the deposit of atherosclerosis or plaque or sludge, or however you want to think about it, that lines the arteries. It can get embedded in the wall of our arteries. It can start to constrict the blood flow. What causes it is cholesterol and inflammation. And cholesterol, like I said, you get some from your diet, but a lot of it your body makes on its own. And it tends to make more cholesterol the more saturated fat you eat. And I think that's something that not everybody is aware of, that the amount of saturated fat that we get in our diet is directly linked to what our cholesterol levels are. So these are kind of the building blocks. You need cholesterol. If everyone's cholesterol was 70, there have been studies that showed that in populations where the cholesterol on average is 70 or lower, they don't get heart disease. So cholesterol and then plus inflammation are the building blocks for coronary artery disease. Next slide. Arrhythmias or abnormal heart rhythms is incredibly common. I would say that at least a third of the people I see every day in clinic have some form of heart rhythm problems, some arrhythmia that I'm trying to sort out for them. And the most common, and the reason I'm focusing on this one, atrial fibrillation, is it is the most common. It's more common as you get older. And are we able to run that again? It was moving. Yeah, maybe go back one slide and then go forward again. Yeah, there we go. So you can see the one on your right, the one on the left is squeezing normally and efficiently, and then the one on the left is on the right, is very chaotic and beating very irregularly, and that's what atrial fibrillation is. And it can usually make your heart beat way, way, way too fast all the time, whether you're sleeping or you're resting or you're running or you're doing whatever. And so it's like your heart is running a marathon when it should be resting and relaxing. Okay, next slide. And atrial fibrillation is very, very much a disease of inflammation. So things like inflammatory foods, infections, alcohol, even extremely high levels of exercise, I'm talking about like ultra athletes, can be predisposed to atrial fibrillation because of that level of exercise actually can increase inflammatory markers in their body. And so that's been actually demonstrated. Other risk factors for atrial fibrillation are high blood pressure, obesity, low carb diets. And that's actually because the low carb diets tend to be very, very low in fruits and vegetables, which have all of those wonderful anti-inflammatory properties. And the AFib is a disease of inflammation. So you're eliminating all of those wonderful anti-inflammatory molecules, and you're eating more meat or animal-based protein, which tends to be very pro-inflammatory. Next slide. And then finally, under the arrhythmia category, this is kind of the real tough one. And this is the one that people don't often survive from. So a cardiac arrest is exactly how it sounds. Your heart basically stops, and that's it, unless you get resuscitated in time. And so the top EKG tracing is a nice, normal, steady heart rhythm that's providing good circulation to your body. The bottom one, ventricular fibrillation, is a very chaotic, just quivering of the heart. The heart's not doing anything. And if this is not aborted, if we don't shock somebody out of it and get them out of it immediately, eventually the heart will completely stop. And that's a cardiac arrest. And it's also it's the cause of sudden cardiac death. Okay, and that's a lot of what we're trying to prevent in treating all of these different disease processes. Okay, next slide, please. So I just want to move on to stroke. I have a lot of patients tell me that they fear having a stroke more than they fear dying. Having a stroke is terrifying. And I've seen some really devastating strokes. I forgot to mention back with atrial fibrillation, I mentioned that the heart can go too fast. The two big complications from atrial fibrillation where the heart is beating very erratically and beating too fast all the time are going into congestive heart failure because your heart's working too hard all the time. Like I said, it's like running a marathon, and it never has time to rest, and so it gives out. The other big risk with atrial fibrillation, and maybe some of you are on blood thinners, maybe some of you know somebody who's on a blood thinner, is that they're at increased risk of stroke because the blood in the chambers of the heart kind of sits in the corners and it doesn't move through your circulation as efficiently as it's supposed to. And so what does blood do when it just sits around? It clots. And if that clot breaks off from your heart and moves through your circulation, worst case scenario is it gets lodged up here. And it's just really awful. So there's two main types of strokes. The one on the left is the atherosclerosis type of stroke, where you've got plaque buildup in your arteries, and it basically closes off eventually, and you don't have any blood flow past that blockage. Another example of that type of stroke is from the atrial fibrillation. If a clot breaks off and lodges in a blood vessel, and all of a sudden you don't have any blood flow past that obstruction. The one on the right is less common, but often more deadly, is a hemorrhagic stroke, where a blood vessel ruptures. Maybe it's an aneurysm, maybe the blood pressure was too high and it causes a rupture of a blood vessel. And that hemorrhagic stroke it causes bleeding into the surrounding brain and can cause just devastating damage. Okay, next slide, please. And just for like a public service announcement, and this is something to share with your family, there's this mnemonic Be Fast that's really important to just remember. Even if you don't remember every single step, these are important changes. If you see a loved one who's showing even one of these signs, it's time to call 911. So the B stands for balance loss. They might experience vertigo. They might have a difficult time walking in a straight line, and they keep veering off to the right. Eyesight changes. You commonly hear people say that they feel like a curtain is coming down over one or both of their eyes, or they've all of a sudden lost vision on the right side of their visual field. The face drooping. If you're worried that a loved one is having a stroke, have them smile. Okay, so when you smile, most of us have both sides go up. If you're having a stroke that's affecting one side of your face, you might not notice it if they're not smiling. But if they smile, one side will go up, the other side just stays put. All right, that's called a facial droop. Arm weakness. One easy way to test for arm weakness, instead of having people squeeze your fingers, so you could do that also, but a more reliable way is if you have somebody hold out their arms like they're holding a platter in front of them. And if they can keep both of their arms up, that's a good sign. But if they're unable to even raise one arm, or that arm goes up and then they can't keep it up and it droops down, that's also a bad sign. And then speech difficulties. If they can't speak, if they have garbled or speech, or they're kind of speaking gibberish, you ask them a question and there are these words that come out that don't make any sense, then you get to the T, and that's time to call 911. All you need is one of those. And it's always better to be safe than sorry. Okay. So finally, congestive heart failure. So most congestive heart failure is due to a lot of these other diseases that I just talked about. If you have a heart attack and one of your heart arteries got completely clogged off, 100% blocked, and even if you ended up getting a stent, often the heart tissue downstream from where that blockage was, dies. Some of it dies. Some of it gets salvaged. Some of it is able to recover, but you end up with some scar tissue. And so, you can lose 30 to 50% of your heart muscle or more if you have multiple heart attacks. Fast heart rates, like atrial fibrillation I mentioned, high blood pressure. If you think about it, your heart's a muscle, and it's kind of like you're going to the gym. And you go to the gym and you lift weights and you're getting these really big bulging biceps. Well, you do your set of weights, and then you need to put the weight down and let your arm recover. It's got to recover and rest for a little bit, and then you can maybe do a few more, but then you take a day or two off. You need to let those muscles rest and recover. Well, your heart can never rest, really. It's always got to keep pumping. So you want to make it as easy for it as possible during the times when it's allowed to rest, when you're not exercising, when you're not running up a flight of stairs because you're late for your doctor's appointment. That's when you're sleeping, or you're just relaxing reading a book. If your blood pressure is high all the time, then it's like your heart is lifting weights all the time, and it never gets a chance to rest. So high blood pressure is considered, or hypertension is the other name for it, is considered silent disease, because most people can't feel it until they have a stroke or they go into congestive heart failure. Valve disease, like a mitral valve or your aortic valve, if they have any dysfunction of them, it can cause congestive heart failure. Obesity and diabetes can cause congestive heart failure. And then, of course, there are some hereditary or familial causes. Next slide. So this is just a little graphic that shows kind of what a normal heart looks like. And here you can see these two upper chambers up there, and there, the atrium, and then this is the right ventricle, and that's the left ventricle, and they're very nice, normal in size, normal wall thickness. And then on the right, you can see that left ventricle, that wall, the myocardium, the heart muscle is thin, like it suffered some damage, like maybe a heart attack, and the heart is really dilated and it's weak. And your heart function, a normal heart function, every time it squeezes, it doesn't squeeze out 100% of the blood every single time it squeezes. It fills with blood, and then it squeezes out about 50 to 70% of the blood. That's normal. Then it relaxes and dilates, and then it squeezes out another 50 to 70% of the blood. That's called your ejection fraction. So people who have really weak hearts, congestive heart failure, they sometimes are only squeezing out 30% of the blood. Sometimes they're only squeezing out 10% of the blood. The people who are getting down really, really low, where their heart's barely moving, it's barely squeezing, that's when they have really advanced heart failure, and there's fewer options for them. Next slide, please. So now we're going to get to the kind of second part of the talk, where we talk a little bit more about the fun stuff, like how you can actually prevent any of these things happening. And I like starting with the kind of the diseases or the things that we are trying to prevent, so you kind of know what we're talking about. Like, what do I mean with congestive heart failure? What do I mean by heart attacks? That sort of thing. And so now we're going to talk about how to prevent those things from happening. So a lot of people will come into my clinic and say, well, you know, I've got this family history of heart disease, but our genes are not our destiny. And I'm sure you've heard that in these classes before. So it really only your genetic predisposition for cardiovascular disease I'm talking about, not necessarily for certain cancers or other things. I'm talking about for cardiovascular disease. The genes really only account for maybe up to 20% of your likelihood of getting that disease. The rest of it is what we're doing, our lifestyle. So, and multiple studies have shown that diet and lifestyle changes in behaviors can prevent and reverse cardiovascular disease. Next slide. And so there's a lot of evidence, and you might want to look into some of these trials yourself. You can go on like Wikipedia. That's actually not a bad source for some of these. There's an entire book written about the China study that's really informative. But basically what these studies have done is they look at large populations of people in various parts of the world. And they found that those people who had the kind of healthiest lifestyles, some of the things that we've been talking about in these classes, they exercise regularly, they eat a plant predominant or entirely plant-based diet. They have a really strong community and social network. They don't tend to smoke. The Adventist trials is a great example. It's one of my favorite population-based trials because the Seventh-day Adventists tend to have very healthy lifestyles at baseline. They really emphasize exercise and taking care of their bodies and not smoking and not really drinking a whole lot of alcohol. But there is some variation in what they're eating. So some Seventh-day Adventists still do eat meat or eat fish or eat eggs and cheese, and some are strictly vegan. And so they were able to compare these people who otherwise were pretty similar because their faith and the other lifestyle factors that they practice because of their faith were all very similar. And they found that the people who ate a whole food plant-based diet lived the longest and lived free of disease the longest. So, and a lot of these studies have shown the same thing or similar things. Next slide. So Dr. Caldwell Esselstyn is a cardiologist who I think this started in the 80s, is that right, Scott and Charlie, when he started with his small sample of patients. He took these people who had advanced cardiovascular disease. They were called the walking dead because they didn't have much time left. In fact, a number of them were turned down from having bypass surgery because the surgeon said, I don't think we can do anything for them. They may die during surgery. They're too sick. And they couldn't walk across the room without having angina, which is chest pain coming from the heart. And he took these people, it was a small group, and he said, if you want a chance, I want you to go on a whole food plant-based diet. And so they all did it. And then I think one fell off the bandwagon. They weren't able to complete it. And they had a number of cardiovascular events over the 6 years that they were followed. And the other ones had improvement in their angina. They had no more heart attacks. They didn't need bypass surgery. They got better. They got better. And this is before statins. This is when we didn't really have a lot of medications as options to treat them. And so here, if you look in panel A, this is an angiogram. This is a heart catheterization. It's a coronary angiogram. And you can see where that white marker is that somebody marked off. You can see where the artery becomes really narrow and kind of lumpy bumpy. That's all plaque that's blocking up that artery up to about 90%. And then, 32 months later, they did another angiogram just because they were feeling great. And he's like, well, do you mind if I take another look and do this angiogram and let's see what this shows and what you have? And no medications, no stents. That is that same artery that healed on its own through just lifestyle interventions, a plant-based diet. Okay, next slide, please. So all the way back decades ago, people were starting to make this connection that we can help heal people and heal their arteries through changing their lifestyle. And there are a lot of names for kind of plant-focused diets. And these are just a few of them here up on the screen. And they're all similar. They're not identical. The portfolio diet is probably the diet that is the same or similar to a whole food plant-based diet. There's no meat in that diet, no animal products, but they do emphasize certain things like viscous fiber, which is a type of soluble fiber that helps decrease the absorption of cholesterol in your gut. It emphasizes nuts and seeds, which are good for lowering cholesterol. It emphasizes dark green leafy vegetables and all of the different, fruits and vegetables, the colors of the rainbow. The MIND diet was specifically looking at how to prevent neurodegenerative disease like dementia through a plant-based diet, and it showed that improved it. Mediterranean diet, as many of you know, is not a 100% whole food plant-based diet, but it's certainly a great, wonderful step forward from the standard American diet. And it's a wonderful diet, but there are some better options even above and beyond the Mediterranean diet. So, and then I put a question mark next to vegan. Does anyone have a clue why I put that on there? Why? Yes. So vegan diet, all that tells people is what you don't eat. And I always tell my patients I hate the V words because it doesn't really help. Can you go to the next slide, please? Vegan diets have a spectrum just like the rest of the dietary spectrum is in our country. And you can be a really, really unhealthy vegan and eat a lot of processed food that is not good for you. And it's not going to necessarily lower your risk of disease. And so there's, when we talk about carbs, for instance, which a plant-based diet is very high in carbohydrates. There's the healthy carbs, which are the complex, nutrient-dense carbs that tend to be also low in calories. It's very high in fiber. It's high in vitamins and minerals and all the antioxidants and phytochemicals. And it's a very, very healthy diet. And then there's the processed carb diet or carbage. And the processed carb diet is highly refined, loaded with sugar, oil, and salt. It tends to be nutrient poor, but calorie dense. And that's sugar sweetened beverages, pastries, sweets, vegetarian ultra processed foods, trans fats. So that's often the what's added to the pastries and these processed foods, the partially hydrogenated oils, and then also tropical oils. Those are vegan. Coconut oil, palm oil. You can find palm oil in a lot of peanut butter and almond butter. What? Yes, exactly. Yes, it's destroying forests. So, that would be something like the fake meats and the fake cheeses. Yeah, it also is. I guess no. This wouldn't include that. But it would be it's the foods that have been advertised to help people make the transition. Is the way I think of those. So it's like the Beyond Meat, the Impossible Burger, and to be honest, if that is somebody's step in getting toward more healthy plant-based sources of protein, I have no problem with that, as long as it's a step. Okay, we're trying to get people to transition. Okay, so I just went to this conference and we had a couple of wonderful talks about ultra-processed foods. You know who Dr. Michael Greger is, right? Yeah, he gave a great talk about it. It was really excellent. And there was another doctor from Stanford who gave a talk. He's a PhD there and does a lot of plant-based research. And this is kind of my own feeling, is that we need to meet people where they're at. If somebody's coming from a diet that's very heavily on the side of the spectrum of standard American diet, and it is unfathomable for them to consider eating a meal without meat, and there are lots of people like that out there. If they need to use that as a transition to kind of get in that direction while they're moving their way toward beans and soy and nuts and other legumes, then fine. Okay, so we're trying to get them in that direction. But that's kind of what they're talking about. But there was a study that showed that people who had an unhealthy vegan diet, like Oreos, French fries, French fries are vegan, and that their outcomes, their inflammatory markers and their metabolic factors in their body, like their cholesterol and things like that, were actually less healthy than people who ate what was called in the study a healthy omnivorous diet, where these people ate lots of fruits and vegetables, but they still ate meat and some cheese and eggs, but they ate lots of fruits and vegetables. Their outcomes and their measurements, like their A1C and cholesterol, were better than the people who had an unhealthy vegan diet. Next slide, please. So another question that people often ask me, and these are great questions that people ask me about, what do I eat to lower my blood pressure? What do I eat to decrease my diabetes numbers and my cholesterol numbers? And I just want to emphasize, kind of like I said in the beginning, what's good for your heart is good for your head, which is also going to be good for your pancreas, and it's going to be good for your kidneys. If you eat the plant-based dietary spectrum, all of the different fruits and vegetables, the colors of the rainbow, all of the different incredible beans that are out there, and different nuts and seeds, and you use all of these different spices to flavor it, you're going to be fine. You're going to be fine. Now, maybe you want to emphasize, and we're going to talk in a little more detail, certain foods on a daily or every other day basis, but I don't want people to lose the forest for the trees. Eat a variety. Eat the different colors. Try and mix things up. Have any of you ever heard of the challenge of trying to eat at least 30 different fruits and vegetables every week? Have you talked about that at all? Yeah, a little bit. Yeah. I did it one week. I was really kind of like, okay, I only need like 2 more. So aim for that. Try and see how many, just to challenge yourself, different fruits and vegetables. And they could be the same type of fruit. For instance, it could be apples, but get a Granny Smith apple and then get a red apple. Don't just eat bananas every day. Mix it up. Next slide, please. Okay, so specifically foods that have really been shown to help lower cholesterol and lower inflammation. So nuts, especially walnuts and Brazil nuts. The Brazil nuts are high in selenium, which is really good for you, but you can overdo it. You can get selenium toxicity, so stick with only 1 or 2 a day, or a couple every other day, a couple times a week. Citrus, all of the different berries, but especially the dark blue and red berries. Apples, purple potatoes, and sweet potatoes, by the way, are very anti-inflammatory. Mushrooms, onions and garlic, and green leafy vegetables. And then it got cut off, but my favorite food, beans. Okay? So good to lower cholesterol and lower inflammation. Next slide. So a lot of people ask, well, what are like the best anti-inflammatory foods? Well, number 1 is turmeric. I put turmeric in my oatmeal. I put it in my smoothies. I put it in hummus. I mean, there's so many different ways you can incorporate turmeric. Ginger, garlic, green, black, and chamomile teas. Also, dark chocolate can be anti-inflammatory. And coffee, as long as it is not the unfiltered coffee. That's not necessary. That can actually raise cholesterol, which is unfortunate because I drink French press. So that's not good for me. Fiber, it produces those short-chain fatty acids, which are very anti-inflammatory. And then foods with the highest nitrate levels for increasing nitric oxide production, which is also one of my favorite chemicals. It is, this is Dr. Caldwell Esselstyn's recommendations. So dark leafy greens. And if you ever watch one of his YouTube videos where he's giving a presentation, he gives this little chant. He does this little chant or song where he lists all of the foods, the dark leafy greens, that are the highest in nitrates. And these are the ones that he really emphasized people ate when he was trying to reverse their cardiovascular disease. So this includes Swiss chard, kale, spinach, arugula, beet greens, and beets. It's not dark leafy green, but beets are up there too. And then mustard and turnip greens. You can kind of see the list there, as well as other types of vegetables. And if you add a little vinegar, the acetic acid in vinegar increases the enzyme in your body that helps convert it into nitric oxide. So a little tip. Next slide, please. So I just want to focus one slide on fiber, which, have any of you read that book, Fiber Fueled? So good. It's one of my favorite books. And I think that I like it so much because it really was eye-opening for me as to the importance of fiber in our diets and how we tend to overemphasize protein so much. Protein's important. All of the macronutrients are important. But we forget about poor little fiber, and it is one of the best macronutrients that we need and can keep us healthy or make us healthier. So there's different types. There's soluble and insoluble, and you can see the examples there. And the fiber, in order to produce a healthy gut microbiome, we need fiber. And in order to digest the fiber, we need the good, healthy gut microbiome. So how does that work? Well, let's say you have somebody who's starting off on a very low fiber diet. They're eating the standard American diet. If they all of a sudden decide, okay, I'm going to eat more fiber in my diet, I'm going to eat 50 grams of fiber tomorrow, they're not going to feel very well. They're going to be pretty miserable. And then they're going to say, see, I knew I couldn't eat broccoli and beans. I knew it. I keep telling them I can't have cabbage. And see, I'm going to go back and eating my hamburgers and French fries. So you've got to start low and go slow. Okay, that's got to be everybody's mantra as they're trying to increase the fiber in their diet. And so as you start low, you'll be able to digest it in small amounts, and then you slowly increase the types of high fiber containing foods you're eating. You slowly increase the amounts, and you're going to develop healthier gut bacteria and protozoa and all of the gut microbiome that will help digest this fiber, and they're going to kick out the bad guys, the bad influencers in our gut. And then you're going to be able to eat more fiber, and the more that you're eating and the healthier the gut microbiome that you have, the more short-chain fatty acids that you're going to produce. And as Dr. Will Bolsewitz says in his Fiber Fueled book, it's the most healing nutrient in all of nature. Which, I mean, maybe some people will find that debatable, but it's a pretty great nutrient. So that's my recommendation for people who maybe aren't getting enough fiber in their diet. You can do it, but your mantra should be start low and go slow. Next slide, please. And then, I don't know, what time is it? Oh, is that clock accurate? 8? Okay, I just want to spend the last few minutes on some of the other pillars of lifestyle medicine because nothing is in a silo, right? So if we are not getting enough sleep, we're either not getting enough or it's not good quality sleep for whatever the reason, we're probably not going to exercise or be as physically active because we're tired. At least I'm not. When I'm tired, if I was on call the night before, I tend not to exercise as much or at all. So then you're not getting the physical activity that you need. It's also been demonstrated that your brain, there's certain receptors in your brain that kind of get switched on when you're sleep deprived, especially chronically sleep deprived, that makes you crave high fat and like processed carbohydrate foods. And same thing, like I'll notice that I really want just a big plate of pasta when I'm tired. It just sounds good. So it makes you eat differently. It's not out of your own volition. You actually crave things differently. The other thing that sleep deprivation does is that there is a chemical that your body, it's a hormone that your stomach produces. It's called leptin. And leptin signals to your brain when you've been eating, hey, I'm full. So you don't feel hungry anymore and you stop eating. Your leptin levels go down when you're sleep deprived, so you tend to overeat more. Okay? So we're picking maybe less healthy food choices. we're eating more, and we're exercising less. And that's all just from sleep deprivation. Okay. We also may choose to have maybe a couple of alcoholic beverages before we go to bed because like, oh, I'm tired and I just really want to get a good night's sleep. So I'm going to have some alcohol. Maybe that'll help me sleep. That it doesn't work that way. That makes your sleep quality even worse. So just one of these factors, one of these pillars being out of whack is going to affect all of the other ones. If we're dealing with a lot of stress, whether it's at work or with your marriage or your family or health issues, and you don't have healthy stress mechanisms, then you often are not sleeping well. You're up at night doom scrolling on your phone. You are maybe emotionally eating, or again, reaching for the cocktail at the end of the workday because you had a really stressful day at work and that's going to make things better. And so it's all kind of a cycle. It's all a cycle. One thing can affect the other. And, you know, when it comes to stress, there's no such thing as having a life with no stress. There's this psychologist that I really like who said once, her name is Dr. Susan David. She says, having a stress-free life, those are the goals of a dead person. Only dead people have no stress in their life. So it's really not just, it's not trying to avoid stress or not have stress. It's how are you going to react to it? You know, what are healthy ways that you can handle stress that might help you handle it better and feel better about whatever situation is going on? And that's getting a good night's sleep. That's exercising. That's drinking lots of water instead of other substances. That's eating better maybe earlier in the evening, and so you're sleeping better at night. It's reaching out to other people, having better social connections, or reaching out to your support system to talk about the things that are going on in your life and not just dealing with it only internally and not really, and maybe feeling very alone. So everything's connected. And, you know, when it comes to our heart health and our nutrition choices, sometimes it's good to look outside the box and see if there's other things going on in our lives that are influencing those choices. Next slide. So I think I'm pretty much wrapping up here. I have one more slide after this that's some of my favorite resources, and it's actually a condensed list because I have so many different resources that I like to give to my patients. I actually have I put it in my after visit summary, and you know, coming to this talk tonight, and I'm really glad you all came, or coming to a doctor's appointment and hearing some of this stuff during a short doctor's visit is great, but it's really going to be doing a lot of your own research and looking for some of these other resources because, you know, there's only so much time you have like with your provider or here at these meetings. What I was saying earlier at the very beginning about not having any formal training in this, and you might not hear the same information from some of your other doctors, your other healthcare providers. Even if you go to a dietitian, you're not going to hear necessarily this same information. They might tell you something a little different that you're like, wait a minute, that's not my understanding of what's a healthier diet choice. And this education takes time for people to catch on, and you have to give people a little bit you have to understand maybe where people are coming from. There's so many influences out there affecting what we're told is healthy for you. I mean, there's social media, and even the government programs are very heavily influenced by lobbyists, by the food industry, by the processed food industry. So even getting information from what should be reputable organizations doesn't always align with what we feel and know are the scientific basis for what we're telling you. It's because there's money involved. There's always money involved. And it takes a while sometimes for this information to get disseminated to the rest of the healthcare system, which is why it took, decades and decades for doctors to finally tell their patients to quit smoking while they're sitting there smoking in front of you. You know, it takes a while sometimes. So I'm glad that you're here and that you're coming and spread the word. And again, if you ever do need to see a cardiologist and you'd like to come and see me, I put my cards out in the back. So, and then if you could just show that last slide with the resources. Yeah, thanks. The documentaries that got cut off, they're like forks over knives. I really love the documentary Game Changers, which is about professional athletes who are getting all their protein from plant-based sources. Excellent, very well done documentary. So those are the other, I think, 2 that I put on there. But any questions? Yes.
So my husband and I both have high cholesterol,
Mm-hmm.
and so many years ago,
I can repeat it, Scott, too, if you want.
we both had 0 calcium score. So fast forward several years, we still both had high cholesterol. We had a second calcium score. His was still 0, mine was not. Can you talk about calcium scores and
Yeah.
what they mean and
Yeah.
what's good and what's, I mean, obviously 0 is good, but what's bad and
Yeah. I gave a 1-hour presentation recently on calcium scores, so I'm going to give a 1-minute answer. Calcium scores are considered risk enhancers. So the traditional risk factors when we're trying to calculate, well, what's your risk of having a heart attack in the next 10 years? What's your risk of having a heart attack in the next 10 years? Well, it's based on your gender, your age, what your cholesterol is, what your blood pressure is. If you have diabetes, are you on medications to lower your blood pressure or cholesterol? And we kind of incorporate that into an estimate, and it's a population-based estimate, meaning we look at people who are like you and give you an idea, a guesstimate of what your risk is. And you can add a calcium score to that. So calcium score should only be used for people who are not having any symptoms. We're not doing stress testing or anything like that. It's just to give you more information. If you have a mildly elevated cholesterol, do you really need to go on a statin? Not necessarily, and especially if your calcium score is 0. That gives you actually a very good prognosis over the next 10 years, and it gives you time to work on diet, physical activity, weight loss, whatever it takes to help lower that cholesterol. So there is something called a double 0 or a double negative. So if you get a calcium score that's 0 at year 0, and then 5 years later you get another one and it's still 0, your prognosis for another 10 years is very, very good. If it's going up, it kind of depends on how fast and high it's going up. If it's accelerating very quickly, then you might want to be a little more aggressive in getting that cholesterol down, because remember, it's one of the building blocks of coronary disease. So getting it down as low as you can, naturally, through lifestyle if you can, and if not, sometimes it takes medications, and that's kind of where the calcium score can help. Now, if it's gone up a little bit, I wouldn't freak out. I would just say, okay, let's go and see, where can I make tweaks? Where can I make some tweaks to my regimen, to my diet, is there any low-hanging fruit I can eliminate, get rid of, that might help lower that cholesterol a little bit further. Yeah. It's hard when your partner maybe has a slightly different risk profile, but that, remember, these are all just, when we talk about somebody's risk, it's not a guarantee. It's a risk. It kind of depends on what kind of risk taker you are. If somebody smokes, they're at a higher risk of getting lung cancer. It's not a guarantee they're going to get lung cancer. If you don't smoke, it's a really reassuring you're probably not going to get lung cancer, but you still could get lung cancer, So nothing is certain. So, yes, yeah. A lot of people take calcium for their bone health, and I'd probably have to defer to a primary care provider for like the most updated evidence, but you can get a lot of calcium through a plant-based diet. Like collard greens have calcium in it, and then there's fortified foods, even fortified plant-based milks, you can get extra calcium. calcium is not associated with calcification of your blood vessels. That's different. But most people are taking calcium for bone health, and they're often taking it with vitamin D if they're deficient. So, calcium? So again, that's a better question for your primary care provider. You would be told that you might benefit from it by getting an evaluation of your bone health. So getting a vitamin D level, possibly getting a bone density scan. However, even if your bone density scan shows that you have osteopenia, which is just below osteoporosis, the best ways to prevent fractures is not by necessarily taking calcium or I mean, you do want your vitamin D replaced if it's low. But the best way to prevent fractures, resistance training, so weightlifting, resistance training, and not falling. And I know you laugh, but it's actually a very common sense goal. Don't go walking outside when it's icy. Don't go walking outside when it's icy. Okay? Don't look at your home and look and see if there's slippery rugs or places that you'd be vulnerable for falling. If you frequently get up at night, maybe to use the restroom, put some night lights in the hallway outlets. So there are things that you can do to prevent falls. I mean, that's a real legitimate goal of using common sense. But a lot of people forget about resistance training when it comes to physical activity. So don't forget about resistance training. It's one of the best things that you can do for two reasons. One is it improves bone health. And two, it just improves your strength, so you're less likely to fall because you can recover. If you trip, you can recover because you've got some good, strong muscles. So that's, yeah. Then don't get one. They're not, the question was, what if you don't believe in DEXA scans? Don't get one. Just do those other things. Try and get calcium, get some sunlight, 15 minutes a day, maybe get your vitamin D levels checked, and do resistance training and don't fall. Yes? I see a lot of people like that. Yep. It's really, really high. Yep. Oh, she doesn't have the question yet. Go ahead.
There's apparently a new, I don't know if it's new, there's the only place you can get it is OHSU as a process, almost like dialysis.
Yeah.
Do you know about that?
I do. Yeah. It's plasmapheresis. Yeah. Or apheresis is really what it is. So the question is, for hereditary high cholesterol, what is the role for a special procedure where it's kind of like dialysis? It's an apheresis machine where your blood is taken out, and when you have that high cholesterol, for some people, their blood can look almost milky or creamy. That's how much cholesterol's in it. And it kind of looks like there's fat in it. And there's a process where, is it like once every 6 weeks or something like that? You go and you get it removed from your blood, and then your blood's put back in, just like dialysis. Couple of responses is that there are medications that can lower cholesterol. Sometimes it's not enough, and sometimes people don't tolerate them. Number one. Number two, for certain types of hereditary high cholesterol, there are some newer medications coming out on the market that might be very, very effective, but they're not here yet. And this is, again, these are people who are trying to do all the right things, and their LDL cholesterol, we want it 70 if we can. Theirs are over 200. They're 250. They're really, really high, and it's not their fault, so yeah. Yes.
Research on that I should be eating, that I do.
Mm-hmm.
Turmeric and chamomile tea,
Yeah.
and things So
Yeah.
well, I'm trying to, well, I don't want to be on a anticoagulant for the rest of my life.
Right.
And I'm not sure I even need to.
Mhm.
It's my occasional AFib. So what do they do to like look at these other things that
Mhm.
you say have anticoagulant effects, yet there's no research on
Right.
it I can find.
I have a short answer for you. So the question is there had been any studies or research done on the blood thinning properties of certain foods or spices? And the answer is not to my knowledge, I don't think at all, other than maybe in a lab, in a petri dish, or maybe animal-based testing. And the reason is that the turmeric industry doesn't have a big enough lobbying group to get the money for research like that done, as opposed to a pharmaceutical company that will do their own research on the drug that costs a lot of money. That being said, because I've seen some devastating strokes, for people who I'm really worried about their risk for strokes, say from atrial fibrillation, I don't want to mess around with this might help, or maybe this will be okay, and maybe you could try this, as opposed to something that I know has evidence to show that it works. The longer answer to your question is that if you really wanted to come off of blood thinners, there are some procedures, because that carries some inherent risk that might allow you to get off them, so you don't have to be on them for the rest of your life. So it's called a Watchman device. Yeah, so. Yes. Great, yeah. Mm-hmm. Mm-hmm. You're right. Right. No. Good. Yeah, so the question is what if you have a persistently elevated, even if it's only mildly elevated cholesterol, despite 100% whole food plant-based diet and trying to do, physical activity and keeping a healthy weight, and not so much should you be worried, because you're not worried, but what else to do? And I would say, don't worry about it. If you really wanted to get additional risk testing, you could get a calcium score. Kind of depends on your age. We don't recommend it above a certain age. And you also could get certain other lipid levels that are more genetic, like a lipoprotein little a, which is greater than 90% genetically based. And if that's elevated and your calcium score is elevated, well, then maybe you need to have a conversation with your primary care provider, or go see a lipid specialist, a cardiologist. But other than that, for LDL that's very mildly elevated, if the rest of your risk is low and you can get that risk, you can have that risk calculated, and if it seems really low, I wouldn't worry about it. Keep doing what you're doing. Yep.
There's also the portfolio diet, which you mentioned earlier. You could check into that with some of the plant sterols and things to add. So that's Dr. David Jenkins out of Toronto, Canada. And it's basically plant-based diet like you're already doing, but a few extra things you could add to your diet that may lower it a little bit more.
Yeah, like the Brazil nuts, walnuts and seeds, the plant sterols. Yeah. So. All right. Yes. Uh-huh. I mean, I'm guessing they probably don't taste very good. Yeah, no, I would toss them. No, yeah, I would definitely toss them. And just for a plug for Winco, where that grocery store tour is taking place at the end of September. Wait, no, when is it? No, next week.
September 4th.
It's next week,
Yeah.
next Thursday. That Winco is just like one of the greatest stores as far as getting all of those seeds and nuts and different rices and beans all in their dried bulk section. And there you can easily replace your walnuts and eat them and then go and get some more. And it's really, and just use reusable, bags. And so you're not wasting plastic bags. And yeah, it's such a wonderful store, and it's very affordable, very affordable. So. Yeah, not always great, but very affordable. Yes. Because the age is usually 75. Above what age is calcium score no longer recommended, and that's around 75. And the reason is that many people, and I have ordered it in people who are over 75, but we've talked about it first. We've had kind of a shared decision-making discussion. It's because many people have a little bit of calcified plaque in their arteries by that age, and so it's not necessarily recommended as an additional risk enhancer. The other thing is that, those, for instance, a risk enhancer helps us decide whether more aggressive therapy is needed, whether it's diet therapy or maybe a statin, for instance. And let's say somebody wants to get a calcium score and they're 82. It's a little debatable. There's evidence that shows that starting it at that age can be helpful, but statins work the best when you're on it for a long time. They work the best when the longer you're on it. So is it really going to be helpful to start somebody who's 82 on a statin? Kind of depends on the person. So that's kind of one of the other reasons. Yeah. So, thanks for coming, everybody.
Thanks. And next week is our pediatrician, Dr. Eric Colgrove. So hope you can come for that. So it's plant-based diets for pediatrics and families. So if you have kids, grandkids, nieces, nephews, just overall it's a good topic to discuss. So, what do you got, Debbie? Oh yeah.
We have the fundraiser of the bottle drop. So if anybody wants to take a bag, and if you use bottles that you recycle or bring back to the store, we have bags and a little sheet that tells you about, we're not encouraging you to start drinking a lot of soda or anything like that. But we just, like I do, drink bubbly water, carbonated water. So it doesn't matter if it takes a long time or a little time to fill a bag, but each full bag gives us about $9, which adds up over time, and it's very helpful to our organization. Plastic and glass, anything that you typically recycle that has a deposit on it. Okay, thank you. Okay, thank you. And anybody else? Okay, two more. Yes. Thank you very much. Thank you, everybody. Thank you, Zoom participants, too.
Thank you.